All right, we are live. Good afternoon. It's actually a late afternoon for yours truly on the Lunch Learn with Dr. Barry. First of all, I want to apologize for those who may have been waiting for me around 1 or 2 o'clock. It got a little bit more busier than expected. I had a couple more meetings than expected, but, better safe than sorry. We are here. Again, this is... If you're just joining in for the first time, first of all, welcome. I am Dr. Barry, board certified internist, founder of drpsblog.com, and this is the Lunch and Learn. We're on episode 53 of the Lunch and Learn, and I think, when I think about that number, hey Amanda, thank you for joining. When I think about like how crazy that is that we're on episode 53 already, like it's just been absolutely amazing. But you guys' feedback has been wonderful, and I'm just much appreciative of everything that you guys have done as far as, sorry about that, as far as what we've been doing here on the Lunch and Learn. Just trying to check on my computer over here. But today, another important topic. And last week, just to kind of wrap up, we talked about rheumatoid arthritis. We talked about how much it affects women and all of the signs and symptoms and the need to seek treatment as soon as possible. Today, we're focusing even more on the women. In fact, I'm not neglecting my men who I know love watching this, but I know October is coming up, and if you're aware of what October means, especially if you're a woman, right? If you're aware of what October means in that category, it's a big month for you guys, right? Why? And what am I talking about? I'm talking about Breast Cancer Awareness Month. It's coming, right? We got a couple more days before October hits, but I wanted to make sure, I didn't want to wait till all the way until next week, and we were on day 5 of October to really hit home how important this month is, right? So again, today we're talking about breast health, and in particular breast cancer, and why we need to get checked, right? For those who've been following me, my motto is really to try to help prevent the preventable death, right? That's Dr. Barry's motto. If I could do anything when it's all said and done, I want you to be able to say that Dr. Barry helped prevent the preventable death, right? And breast cancer is one of those disorders and diseases that we see a lot in the primary care office. We see a lot, unfortunately, even as an inpatient doctor, I'm seeing a lot of the ill effects of breast cancer, especially in the later stage here. So it's definitely something I wanted to kind of touch on and, make sure that, we go into this month, or really every month, doing very well. Marie, thank you for joining. Good afternoon. I'm sorry I'm starting a little late. I had a couple meetings. So we couldn't start on our normal time, but I guess anytime we can learn, especially on a Friday, anytime we can learn and get some teaching on, I think is a benefit for everybody, right? So we're talking about breast cancer again. What is breast cancer? Like most cancers, it's abnormal production of cells located in the breast. And even though I'm going to be focusing a lot on the women, and then I'm going to actually be talking about a lot of very interesting facts associated with breast cancer in women. It's not just a women's disease, right? I could tell you from a numbers game, 1 in 8 women are affected by breast cancer. 1 in 1,000 men are affected by breast cancer. So it's not 100% a women's disease, right? So even though my men who may be tuning in like, oh, he's talking about breast cancer, I'm not going to turn away. It is something you have to kind of be very mindful of as well in that regards. Yes, you are so right. Men do have breast cancer, Amanda. And again, and I think a lot of times, especially in men, it's more deadlier because men tend to put things off. And I've talked about this on past Lunch and Learns. Men tend to put things off until the last second, right? So until it's really, really a problem, that's when the man is actually going to the doctor's office, right? Women tend to go to the doctor a little bit more frequently. They're more eager to go to the doctor. They're more eagerly to get stuff taken care of when they need to get it taken care of. So that's where they kind of fall in line in that regards. So we talked about breast cancer, located breast tissue, where you have these abnormal cells that form and cause problems. And when we talk about cancer, especially with the cell in general, it's a cell that does not have a turn-off switch. And it's producing very abnormal cells, and it just keeps producing it over and over and over again. Now, there's a whole bunch of different types of breast cancer, and I'll touch more of that specifically when we do the podcast next week. But for here, especially for the Lunch and Learn, I want to make sure I give you guys enough the bread and butter on the top, just so you can, be able to be a little bit more educated. So when you go to see your doctor's office next week, in 2 weeks, next month, you'll be like ready to say, hey, I learned about breast cancer and I want to get something taken care of, right? So we're going to go through, some signs and symptoms, right? So what are some signs and symptoms from a woman's perspective when they should start being concerned, right? Mass, right? We usually tell our women, do monthly breast checks monthly, right? Almost daily if you want. Every time you take a shower, you should be checking your breasts again, just to make sure there isn't any abnormal lumps, any abnormal masses, anything that feels different, especially when you're comparing right to left. And a lot of times, these masses, these symptoms can be so small that you may not be able to feel it. So you may do all of that and not feel anything. But for those who are checking their breasts and, being very mindful of it, that is something to always keep an eye on, right? So always, do your monthly, daily exams. Every time you get out of the shower, you should be doing a quick checkup. It does not take a long time. For those who had it in the doctor's office, it probably takes your doctor maybe 2-3 minutes to check both of your breasts, right? So that's something you could easily do in your own comfort, in your own home, right when you get out of the shower and not even have to think about it, right? So that's for sure with that. Like, we'll start off there. Number 2, right? And this is actually something that you wouldn't think about it, but your nipple discharge, right? Nipple discharge, and we're not talking about breast milk, right? Because that's a whole different ballgame. But discharge from your nipple is very concerning, right? For something that I need to get this taken care of right now, because a lot of times, could it be infectious? Sure. Is there a big chance that it's cancerous? Most definitely. So definitely nipple discharge is something that you definitely need to be thinking about when you have concerns like, oh my God, am I having breast cancer or not? Another thing, especially associated with the nipple, is that your nipples can actually retract. So again, if you have nipple retraction, that's also another sign that there may be a concern that I need to be taken care of in that regard, right? So we talked about lump, we talked about the mass, whether it's small, whether it's movable, whether it's tender. We talked about the nipples, where we talk about whether you're having discharge from the nipple, whether you have retraction from the nipple. A third subset is sometimes you have a growth or like almost like a I want to say a rash, but something like a growth that does not seem to want to heal, located on the breast. That is always very concerning for something that should not be there, right? Whenever you have some type of growth, mass, anything that's growing, and you're trying to treat it and it's not seen to be working, that's when you need to begin to your doctor's office like yesterday, right? Because that's something that we always need to be very mindful of when we're thinking about breast health and breast cancer. Because remember, right now we're not talking about breast cancer, we're talking about breast health. And how can I have the most adequate breast health? And to do that, right, we have to be watchful for what are bad things, right? Because you can't have something healthy if you don't know when it's actually bad, right? Think about it. You don't know what spoiled milk is until you have good milk, and then you taste some spoiled milk, right? So same thing with the breast, right? You don't know if you have a breast that's abnormal until you know you have a normal breast, right? So especially for women, some women have dense breasts, some women have small breasts, some women have big breasts. It all comes in different shapes and sizes, but knowing what's your individual quality of your breast is so important, because you'll be the first person to be like, this area right here does not feel the same as it does on the left side or the right side, and that's where I have some women, which I think is odd, but it's not. I have some women who, when I used to ask them in my office, when's the last time how often do you check your breast to make sure there's anything going on? They say they never do, right? Because for some women, it just does not seem something that they even think about, right? They just, we're not saying they're dirty. They clean them. They do everything they do with them, but they don't go that next step in making sure, again, monthly thorough skin exams, palpation, making sure there's no lumps, there's nothing that seems out of the ordinary, especially when you're dealing with the breast. And I'm actually going to go through some facts and figures, right? Because I couldn't even believe some of these myself, right? It was very telling, right? And again, usually I can tell you, especially from a health professional, it's very evident, right, when they're quote unquote pressing the popular button on a disease, right? Like, for example, right, we're in September, right? I know right now, especially if you're a sports person, right, everything's all about the NFL, right? And right now, the NFL, you don't see any talk about breast cancer, right? No one's talking about breast cancer in the NFL, right? But the second October hits, right? Literally, the second October hits, all of a sudden everybody's going to be wearing pink, right? Because it's going to be like the popular thing to do, right? And what I want you to do is, I don't want you to be only worried about your breast, your colon, your lung, and all this. I don't want you to worry about those things only when it seems to be popular on TV, right? Like, I want you to always be thinking about your health 24/7, right? 24/7, you should always be thinking about healthy. How can I stay healthy? So you'll see, like I said, come next week, everyone's going to be pinked out and talking about breasts and all, and I need you to be thinking about your breasts all the time, right? Because these are some figures, right? These are some issues. The lymph nodes as well too. For those who may be aware or not aware, right? When we talk about lymph nodes, I kind of described it in my podcast. I talked about lymph nodes being almost like the security guard, right? The security guard in the club, right? And before you can get anywhere in the body, right, you have to pass lymph nodes. Anytime there's an infection, anytime there's inflammation, anytime there's a problem, usually your lymph nodes know first, right? Because they have to go through, quote unquote, security guards to get to that area. So a lot of times, some patients can have enlarged lymph nodes. In particular, when we talk about the breast, the lymph nodes are located pretty much right under the arm in that armpit area. Sometimes they can be big, sometimes they can be tender, and that's another sign that when your doctor is doing their exam, most times they're not only are they checking your breast, but a lot of times they go to your armpit and they start feeling around there, and that's usually what they're feeling for. They're feeling to see if there's any enlargement of the lymph nodes, right? So thank you, Amanda, for reminding us on that. So we have some facts. These are some startling, facts, associated with breast cancer, right? 1 in 8, right? 1 in 8 women will be affected by breast cancer. 1 in 8 women will be diagnosed with breast cancer in their lifetime, right? Think about it. You have 8 friends. 1 of y'all will be diagnosed with breast cancer in your lifetime. And again, for men, it was 1 in 1,000, right? So again, they're not non-existent. They are existent, but something to think about. Risk factors associated with breast cancer, being a female, which of course makes sense if we talk about the numbers, but also age, right? The older we get, the more likely we are to suffer from breast cancer. Some outside factors, obesity has been kind of shown with it. Because a lot of the hormonal changes, smoking. And again, this is episode 53. If this is your first Lunch and Learn, you already know how much I hate smoking, right? And there's really I can't think of a disorder that smoking does not make worse. I can't think of a problem that smoking does not make worse, right? So if you're smoking cigarettes, stop yesterday, right? Smoking is bad. Smoking is bad. Let me see. 200, and these are some numbers that 200,000 women each year will be diagnosed with breast cancer. 40,000 women will die from breast cancer. In the United States alone, we have the highest number of survivors of breast cancer. But again, 200,000 every year is going to be diagnosed with breast cancer, right? And the key word is diagnosed. There's a lot of women who aren't diagnosed, right? And we'll talk about how you get diagnosed, but there's a lot of women who aren't even diagnosed, right? So when we talk about 200,000 women being diagnosed with breast cancer, there may be maybe another 40 to 50. I'm just lowballing it. I'm just hoping it's only 40 to 50. There may be another 40 to 50 who don't get diagnosed at all, but also have breast cancer. And there may be some more who don't get diagnosed but also die from it, right? So that's very telling. And again, this isn't just an outpatient thing. I can tell you again, I did outpatient medicine. I'm doing inpatient medicine now. I'm seeing a lot of patients in my hospital with complications due to breast cancer, or I'm seeing a lot of patients in my hospital who this is the first time they found out they had breast cancer when they were in the hospital, right? So this is not something that only your outpatient doctor has to deal with, right? Even your inpatient doctor deals with these things are the same, right? Second leading cause of death in women. This number was every 19 seconds, right? Just to even break it down even more, every 19 seconds someone is diagnosed with breast cancer. Every 19 seconds someone is diagnosed with breast cancer. Every 13 minutes someone dies from breast cancer, right? So again, this isn't, and again, I know, especially because October's coming up and they're going to make breast cancer seem so popular, and it should be, right? It should be popular every single day. but they're gonna make it so trendy. That's just probably a better word is saying trendy. They're gonna make it so very trendy to talk about breast cancer. But this is something that we should be talking about all the time, especially my primary care providers out there. Like, there probably shouldn't be a visit that goes by where you don't kind of mention it or about it. And I used to have patients in my office, even if it wasn't time for their mammogram screening, and we'll talk about the mammogram screening. Even if it wasn't time for that, I'd make sure, like, hey, are you up to date on your? Because I just wanted to know. Because again, that's when you follow the moniker that we have here with the Lunch and Learn, preventing the preventable death, right? Like, these are things that we can prevent, right? We can prevent if we diagnose early enough death from breast cancer. We can prevent if we diagnose early enough death from colon cancer, and all these other things, and all these other like lifestyle changes that we can prevent if we actually talk about it, educate ourselves, and then move on to that next step. So these are just some facts and figures just to show you with breast cancer, right? So what do I do, right? Like, let's say I have some of these signs and figures, or who gets diagnosed, right? Like, how do we diagnose? Women usually start thinking about getting diagnosed at the age of 40, right? If you think about it from a general insurance, let's say insurance standpoint, they want you to start checking for breast cancer at the age of 40, unless you have a family history, right? When I talk about family history, mom, sister, aunt, grandma, someone has had breast cancer or cervical cancer or some other type of cancer sooner than 40 years old, or maybe within 41 to 50, in that range, we start making people check a little bit earlier, right? Because we don't want to miss it, right? If you have a family member, especially on your mom and grandpa too, diagnosed with breast cancer at the age of 42, right? I'm not going to wait till 40, right, to try to screen you for breast cancer. No, I'm going to start about like the age of 30, right? Because I really want to get a jump ahead, right? Because again, you don't prevent the preventable death if you don't try to jump ahead of it, right? So that's where that's at, right? So that's, again, that's what you do, especially when you're trying to prevent it. So again, usually about the age of 40, unless she has a family history. And like, how do we do that? The most common, the most routine way we do it is the mammogram, right? So the mammogram is this magnetic resolutionary test that tests for breast tissue and sees if you have abnormal tissue here or there, right? And there's also breast MRIs and breast ultrasounds, but the gold standard of how to like diagnose if this person has breast cancer is the mammogram, right? It's one of the most definitive ones, right? The MRI is a little bit more detailed, but not everyone's getting an MRI, and not everyone needs an MRI. You'll see now some people are even doing like 3D mammograms and all. Whatever, as long as you get the mammogram, as long as you get it done, like that's all. Honestly, I just want you to get it done. I don't care, like how if you want to spend a little extra to get like a specialized mammogram, sure. It's not as if the specialized mammogram works that much better. It may have a little bit more detail, but your regular mammograms will spot your cancers, the majority of your cancers, just fine, right? So usually the mammogram is the test that we order, and when something's important when insurance companies, right? Like again, I know this week has been a lot, especially with healthcare, and we'll probably have a healthcare. I think we almost have to because they keep trying to take healthcare away. We'll probably have a like luncheon. We'll probably do that next week. Have a politics, healthcare, quote unquote Affordable Care Act one. But anyways. Something's important when the insurance company will pay for it, right? And your insurance companies are not only paying for it, they won't even charge you. If you are getting a mammogram, most of your insurance companies will not even charge you. The reason why they do that, right? It's not because it probably is for the good of their heart, but they save so much money, right? Because if I diagnose breast cancer early, the treatment done early is much cheaper than if I diagnose breast cancer much later, right? So again, they have, they got some, some business aspects of why they're paying for it, but at the end of the day, they're still paying for it, right? So if you have insurance and you're not getting your mammogram, I got questions for you. I don't know why. You got to answer me the question, why are you not doing it? Now, let's say you don't have insurance, right? Because that's the question, and I deal with a lot of patients who don't have insurance. If you don't have insurance, a majority of your community health centers and even local nonprofit organizations in your area, like honestly, you could do, especially next month, Google, free mammogram My City, and you're going to see somewhere where maybe you don't get it free, but you maybe get it for like maybe $25, $50, $75. You may be able to get it for much cheaper. Most of the times when you're going to get a deal for doing a mammogram, it's usually during the month of October, right? So if you say, I don't have insurance and I can only get a mammogram once a year, do it during the month of October, right? Because it's usually much, much cheaper. And again, honestly, just think about it. Like next month, do free mammogram, My City, whatever your city is, and you're going to find some organization that will either pay for it or pay a majority of it or something way to form, because we need to, because again, the numbers are startling. Again, 40,000 women are dying every year because of breast cancer. 200,000 being diagnosed every year. Every 13 minutes, someone is dying from breast cancer, right? So this isn't a disease that we can brush off. We can't brush off no disease, personally, but this ain't the one. You're not going to brush off the one that is the second most leading cause of death in women, right? That's not something we brush off here, right? Especially here with the Lunch and Learn, we're not letting you brush that off, right? So we're gonna go full speed into October, thinking about if maybe I haven't done my mammogram, but maybe my mammogram is due. I'm gonna go get my mammogram. I don't have insurance. I don't know where I'm getting my mammogram. I'm going to Google places to get my mammogram. Susan G. Komen and all these other people, all these other organizations that collect a lot of money. And when some of these organizations collect millions of dollars a year. They collect millions of dollars a year so they can provide mammograms to people who can't afford it, right? So, no more excuses, right? We got to get it done. Again, October, you're going to see on TV, everyone's going to be wearing pink and like sporting pink and telling you how much they so much care about breast cancer. And I want you to know that that's all fine and dandy, but where can I get my mammogram? Or if my mammogram's not due, when is my mammogram due? Again, when we talk about breast health and understanding when we need to do things, right, a lot of it is preventative, right? Preventative, right? Like, how can I prevent, like, that preventable death, right? Like, how can I prevent being one of the women or men who die from breast cancer every 13 minutes? I do that by, one, checking myself daily, every shower, making sure there's no lumps, masses, or anything that seems out of the ordinary. I'm looking for the signs and symptoms. I'm looking for nipple retraction, masses, pain, nipple discharge. I know some of these crazy facts and figures, because I know, even though I'm a man, 1 in 1,000 of me will get breast cancer, and if I'm a woman, 1 in 8. So, like, I know these factors. Like, I'm educating myself, and I know when October comes around, because Dr. Berry said when October comes around, people are going to be trying to give away mammograms, right? And I'm going to be one of the first people to try to take those mammograms, right? So that's it. Again, I apologize for doing the late Lunch and Learn, but again, whenever you can learn, I think you should always learn. So next week podcast again will be on breast cancer. We're going to go a little bit more detail on different types of breast cancer, different types of imaging studies, and everything kind of under the sun there in that regards. But you guys have a great, blessed weekend. Again, October is coming. Everyone's all of a sudden going to be wearing pink, and now you know why they're going to be wearing pink, right? Because they're all going to be worried about breast cancer, just like you should be all worried about breast cancer. So see you guys later. Y'all have a great, blessed day. Bye.